He is in Ohio. And Mark, you and I need to set up straight. The professor is in town. Jeff Lax is here. He is a professor of law, and always good to have you along, Jeff. Let me start with you. We heard healthcare provider after healthcare provider, the nurses, the doctors, those that were on the scene at the hospital, those that interacted with Dr. Husel. And the takeaway, I think, from a lot of that testimony was, yeah, you know, what he did didn't seem totally out of the ordinary to us. There was no hand-wringing, people saying, well, we didn't understand why he did it, but you know, it wasn't our place to object. Didn't hear that. So now we're hearing from one expert that is making it more clear, in his opinion, that these were wrongful acts, perhaps actual murder. What do you think about the weighing of that kind of testimony this jury's going to have to do?
Well, I think the prosecution really did not play this well at all. And you mentioned when you opened your show how many witnesses there have been. So, and you also have referred to how monotonous it can get. I mean, all this medical, technical testimony from monotone doctors and medical professionals. It's really a lot for a jury to take in. But you're 100% right. The jury heard a lot of testimony early on where the prosecution just whiffed completely on their witnesses. They were testifying that there's no one standard for fentanyl. They were testifying that most of these cases were in consultation with the family of the patient. And now what you're seeing the prosecution doing the past couple of days, and they're doing a good job of it after really whiffing for a while, is trying to repair that testimony from earlier on by saying, look, this was higher than any other doctor was giving at that time. And look, in this situation, there was no purpose even for the fentanyl. And that's what you just heard now in the testimony. So they are repairing some of it, but it might be too late in the game for this jury. We're going to find out.
Let me ask you, Mark. I guess everybody's job is so much easier. Hey, Jeff, I've got a law school question for you here. I'm trying to remember how I crafted it because I was very, very proud of it when I came up with it. If you have a case like this where intent is clearly more difficult to prove, what is your best weapon to do that? Is it behavior? Is it statements? What is it that you need to use to prove that intent in the absence of something very obvious?
Well, in terms of how the prosecution could have handled it better, first of all, this is a very tough case. This is far from a typical murder trial. Frankly, to be honest with you, I think this very easily could have and possibly should have been prosecuted as a much lower offense than murder. And I'm a little surprised, frankly, that maybe it was considered, and we don't know, or I don't know, but that really goes to the heart of your question, the mens rea, the mental state of mind to prove murder. We've seen so much evidence in the past 2 weeks that the doctor tried to save many of these patients. So to then also suggest he's trying to kill the same patients when he's also providing care that saves their lives, that's a tough swallow. And so much testimony about the families consulting, as I mentioned earlier, with the doctor about providing this medication and the palliative care. So it's very hard to prove the intent, which I think is the point you're asking about and trying to make. How do you make the intent that he was trying to murder them? That's a very tough one. Very surprised they didn't go for a lower offense.
Yeah, and we may find out, as you guys know, that as we get toward the jury instruction portion of the process, you reevaluate what's been presented, what isn't. Maybe you start to offer up lesser charges because you realize maybe you don't have the strongest case at the original charging phase. We will see if all that develops. I would not. Rittenhouse, of course, was acquitted for the 2 deaths, and one of the defense points was that this warning shot fired by Ziminski prompted Rittenhouse to panic, and that kind of started the whole chain of events. So, question for our professor here, and we were chatting about this, I must admit. Tell us how the felony murder rule might have been applied in this case, because what we've got primarily here are lesser charges. Arson is the felony, but it could have been far worse. What do you think?
Yeah, we were talking about this during the break. He is very lucky, Ziminski is, that he was not charged with felony murder here. And what felony murder is, when you're in the process of committing a felony, like most commonly it's bank robbery, or it could also be arson, which he is charged with, and somebody dies, even if you didn't mean for them to die, even if you didn't want them to die, you are still responsible for their murder, and you could be charged with felony murder. So in this, did you hear what the detective said? 2.5 seconds passed from Ziminski's shot right after he committed arson, and 4 shots from Rittenhouse, one of which or more killed Mr. Rosenbaum. And so, first of all, he's lucky that his shot didn't injure somebody, and that wasn't in itself a felony. And he could have easily been charged anyway with felony murder here because he was committing a felony, and Mr. Rosenbaum died literally seconds later.
So, Mark, the predicate felony being... So, just one of the healthcare providers that we've suggested has played out through the course of this 20-day trial so far. Jeff Lax is here with me. He is a law professor and brings great insights into how this case is being presented, not just the liability and guilt phase, as it were. Hey, Jeff, one thing that bothers me is this system by which you can just override and get whatever meds you need out of this dispenser if the healthcare provider, a nurse, doctor, feels that they can't wait for the, I guess, normal course of authority to release the meds. I guess it's some sort of electronic dispensing device. I can't really picture what it looks like, but the fact you can override it so easily kind of concerns me.
Yeah, it's also interesting how the questioning, they wanted to really hone in on the difference between urgent and emergent. That there was a big distinction there between something that was urgent, which was that, I think that was a nurse who was talking about that the family wanted it to happen, instead of emergent, which would be that the patient needed it. So that, to your point, if you're overriding it for an urgent situation, because the family, not to minimize the family suffering, I mean, there's no question the family suffers maybe more than the patient, but, that's a discussion, right? But urgent versus emergent, that was an interesting distinction to your point about overriding specifically in the urgent, not emergency situation.
Yeah, and so it sounds like they were reacting, the healthcare professional, to the family's wants and needs. Examination cutting right to the motive in this witness's testimony. Obviously, she makes it very clear Dr. Husel killed Troy Allison. He was only 44, by the way, at the time. And the doctor did it, and the hospital is responsible as well. But Jeff Lax, professor of law, I mean, it so clearly goes to her motivation for this kind of testimony. And you layer that with anytime something like this happens, especially with a relatively young person, you're looking for somebody to blame.
That's exactly what I was thinking, that in this situation, even if they're not legally to blame, you as a layperson, you don't care about that. You care that your loved one died, and the last person that had a hand in the medical care was Dr. Husel. So that's a great point, Michael, because you're right. But I also want to add one thing about this whole back and forth here with Miss Menashe and the witness. This is a tough spot for Miss Menashe because she doesn't come off very well here, in my opinion. To attack someone this way about, ulterior motivations, I wouldn't have done it this way. I would have done it more compassionately. Like, couldn't Dr. Husel have done it for this reason or that reason? Instead of talking about money. I mean, clearly this person this is not about money. This is about, like you said, a 44-year-old relative who died.
Yeah, and it is easy to make it sound like you're just a money grubber, and that's why your testimony is so slanted. Lieutenant issue that involved shooting somebody in the chest. Jeff, thank you so much, buddy. I always appreciate you being here, bringing your academic insights, and we'll see you next time here on the network. Have a great weekend.
You too.
Okay.